gut really is the central mechanism in everything. And during embryology, as the fetus is developing, the very first part is the gut, basically, the nervous system of the gut and the immune system that surrounds the gut. So even in embryology, it's the gut, immune system, nervous system of the gut that then drives the development of all the other body parts, making sure they're where they're supposed to be and all this kind of stuff. And so it communicates with every body part. And so when you look at the root cause of autoimmune disease and chronic disease, the gut is part of everyone. So the gut is off, you're not going to be digesting your food, you're going to get vitamin deficiencies. Your gut's off, you can't balance hormones. Hormones gets all out of whack. You get gut issues, 80% of the immune system surrounds the gut, well, you're going to get immune system disruption. Your gut, by pooping, is the main way to get rid of toxins from the body. There's some toxins we can breathe out and sweat out and pee out. Mostly got to poop them out. Well, if you got a disrupted gut, you're not getting rid of toxins, and they're building in your system over time. And then when all of that stuff, and when the gut's off, it gets leaky. That intestinal permeability starts driving food sensitivities. And here's all these foods that can bug you in an obvious way or a sneaky way. But then when all this is going on, it's creating so much stress and duress to the system, it's going to throw the stress hormone cortisol off. And then when cortisol gets thrown off, stress always whacks the gut. And so here's cortisol getting stuck in the stress mode, whacking the gut, throwing everything else off. And so this is where, you really got to focus on the gut. Now, of course, you want to focus on all the root causes, but the gut is such a central mechanism. If you get it going the right direction, now you're going to start getting everything else going in the right direction. And then once you get everything where you want it, that gut and 80% of the immune system surrounding the gut, that's your foundation that you want to lock in place. So then you're doing your due diligence to, prevent people from getting new things down the line, like cancers and Alzheimer's and heart attacks and strokes and all that kind of stuff.
Yeah, it's absolutely key. I mean, one of the things that I try to explain to clients is, if you think of your skin, it's there to protect you against the environment. And, to a degree, I mean, yes, obviously we can absorb stuff through our skin, but where do we absorb our nutrients? It's in the gut, right? So it makes sense that the majority of our immune system is in the gut. It's the place where we are actually absorbing things from the outside world. And what I'm trying to explain to people is, once you've put something in your mouth and swallowed it, it's not technically in your body. It's in the tube that runs through your body, but it's not actually in your body. But obviously, once something is absorbed through the gut lining, now it's in your body. Now it can access your bloodstream. And I think that kind of helps people to understand why it's so important to really look after your gut, because, as you said, that's the center of everything.
Yeah, and that's kind of why gastrointestinal tissue is so similar to skin tissue in a lot of ways, and what will throw off the skin throws off the gut, because basically those are the barriers that keep us separated from the outside world. And technically, even though the gut's sort of inside of us, it's open on both ends, so technically it's not really inside of us, it's connected to the outside world, just like the skin is.
Yeah, I mean, what's the gut lining often called? The intestinal barrier. Right? And what is the skin? It's a barrier to the outside world. To me, it kind of does the same thing. I mean, the gut's probably a bit more complex because obviously it has to allow nutrients through the tight junctions, but it pretty much does the same thing. It helps protect us from things that we don't want to get inside our body.
Yeah, the body has to be very selective, let things in. And boy, is that complicated. Letting things in that we need while keeping things out that we don't need. It is a job.
Yeah, and just looking at it from a very basic level, what is the immune system? The immune system is there to identify anything that shouldn't be in the body. And when it does identify it, what does it do? It attacks it. Right?
Yeah, and that's where the body is so challenging, because like when food comes in, food proteins, well, the body has to decide whether that's friend or foe. And it's not as easy as it might sound. Here's a bad bug, like a bacteria or a virus that gets in. Well, the immune system got to decide if that's friend or foe. But the immune system gets a bit confused because the food proteins can be so similar to our body part proteins that this is kind of what they call like molecular mimicry, and it works either for the proteins on bad bugs or the proteins in foods, where this bug gets in, it's got a protein, and the immune system goes, oh, okay, I think that might be our foe, but I see a very similar protein on the thyroid, so maybe that's our enemy too. So I'm going to start attacking it, and then here you get Hashimoto's, autoimmune thyroid, or food is very similar to the proteins on the receptors for folic acid in the nervous system. The body gets confused, attacks these folic acid receptors, and here's the autoimmune disease that accounts for 70% of all autism. So this molecular mimicry is a really a big driver of autoimmune, but it really highlights how challenging it is for the body. Bazillion times a day, it's got to decide whether something's friend or foe. What am I going to do with this protein that got in?
Yeah, I'm familiar with gluten and synovial fluid being seen as very similar in the body. And if someone has gluten sensitivity, how that can manifest as joint pain for that exact reason.
Yep.
I mean, I've actually told the story before, and it's probably not complete. It's not gluten exactly related, although you might tell me it is. But about 4 years ago, a little over 4 years ago, I started re-eating oats. I hadn't eaten oats for probably 20 years at that point. And what I didn't realize around the same time, I started to get knee pain. So I play a lot of tennis. I work out in the gym quite a lot. I wasn't having problems in the gym. I was having problems in playing tennis. And my left knee, I thought I'd maybe damaged my medial collateral ligament. It might be my medial meniscus, maybe my anterior cruciate ligament. And this went on and on and on. And I just kept thinking, oh, it's going to go away. It's going to go away. It's going to go away. And eventually I was with a friend of mine, and I said, oh, you couldn't just, run some, he's an osteopath, so I can just do some tests on my knee, because I can't test it myself, and see what you think. And he did all the tests for, anterior cruciate, medial collateral, medial meniscus. And he said, no, he said, you got osteoarthritis in your knee. I said, okay, that's interesting. And I could only get about 90 degrees of flexion in my knee. And I thought, okay. And again, I didn't really think too much of it at the time. And then about 2 months later, I just said to myself, oh, I'm going to stop eating oats. And within 3 weeks, my knee was completely pain-free.
Isn't that great? Wow, that's an excellent story.